Welcome back to the Delaware Way. Did you know that you can get a stroke and not even know you had one? It's one of the things I just found out in talking to Dr. Amy Ty, who is a neurologist at Christiana Care and is here to talk more about strokes and how you know might be having one, and maybe what you can do to make yourself healthier and prevent them. First of all, what are some of the risk factors for getting a stroke?
Traditional risk factors include high blood pressure, high cholesterol, and diabetes, as well as tobacco smoking.
And what are the signs that you're having one?
Signs and symptoms of stroke include droopiness on the face, slurred speech, trouble walking where you may be falling over one side or loss of balance, as well as weakness on one side of your body, such as your arm or leg.
I think many of us have heard that ad where the person's saying, "I'm having a stroke," and the other person's not recognizing the signals. It's just as important as you knowing the signals in your loved one as somebody knowing the signals on themselves.
Definitely. Frequently, patients are not aware they're having a stroke symptoms because they're not thinking clearly, or this area of the brain that's been injured and prevents them from recognizing signs and symptoms of stroke. So we educate patients and their family members in order for their loved ones to be able to call 911 and get them the help they need as soon as possible.
Are there some people that are more likely to be a victim of a stroke?
Definitely. Patients that are older in age have some of the risk factors such as high blood pressure, high cholesterol, diabetes, as well as tobacco smokers are at much higher risk of stroke.
Are there things you can do to maybe not prevent a stroke, but at least decrease your risk factors?
Yes, I like to always counsel that there are some things we can't change, such as your age, your gender, or your ethnicity, but there are many other things that you can do to live a healthier lifestyle. Eating right, exercising frequently. The American Heart Association recommends 30 minutes a day, at least 5 times a week of cardiovascular exercise, as well as for patients who have the certain risk factors, need to talk to their doctor about whether or not taking aspirin or other medications to reduce their stroke risk is good for them.
Is finding out if you are at risk to getting a stroke, is that something they commonly look for when you go to see your doctor?
Yes, good primary care doctors will be working with their patients as a team in order for them to live longer and have healthier life by getting them to be on a right diet, healthy habits, as well as taking the right medications.
Have the incidence of stroke, have they decreased? Have we done a better job at fighting it, or is it about the same, or is it increasing?
The incidence of stroke in different age ranges have fluctuated over the years. The thing that's been concerning healthcare researchers and stroke doctors is that more young patients are having stroke, and we think that it's related to the rise of obesity in the younger population. However, because of acute treatments that are now available for stroke, including IV TPA and some procedure-based treatments, patients are living longer and having less disability from their stroke.
So you're getting better at curing the stroke, but we're living unhealthier, and so we're getting strokes younger. Is that the case?
Unfortunately, yes. We do try to reduce as much disability from stroke patients as much as possible with our acute treatments. But of course, the best treatment is to not have a stroke. So in our clinic, we definitely counsel to try how to avoid strokes if possible.
I thought it was fascinating. We were talking right before we went on, and you said it's possible to have a stroke and not even know you had one.
Yes, there are different situations that can occur. One is what we call a silent stroke. There are certain parts of the brain that may have some special properties, but patients may not be using that part of the brain as much as they're aware of, so they may have a stroke there and they don't know about it. And other times, like I mentioned before, patients can have stroke symptoms, but they don't recognize it, but their loved ones do, such as a change in personality, ignoring one side of their world or space, and those types of symptoms, the patients are not aware, but in fact, the family members recognize that there's a change in behavior, and they're the ones that bring the patient in.
Is it important to know that you had one? Does that make you more at risk to having another one?
Yes, definitely. It's important to recognize that you've had a stroke because it significantly increases your risk of recurrent stroke, and we have to put you on the right medications and treatment to prevent future events.
You know, I just realized I've asked so many questions because strokes you hear about them all the time. Everybody
Yes.
knows someone that had a stroke. And I didn't ask what the most basic question is. What is it? What is a stroke?
A stroke is, there are two different kinds of stroke. The most common one that people think about when they say stroke is a blockage of an artery that goes up into the brain. So there's lack of blood flow to a part of the brain. Therefore, that part of the brain becomes permanently impaired or injured. The other kind of stroke, which is less common, about 15 to 20% of patients can have a stroke where there's a burst blood vessel that leads to a large amount of bleeding in the brain, and it can present with similar symptoms.
Is it hereditary? If you had people that had strokes in your family, do you have a higher chance?
There are very specific genetic conditions that are quite rare that can cause stroke, and there are other combinations of risk factors that some patients can inherit from their family that can increase their risk of stroke.
But just because your parents had a stroke doesn't mean you're going to have one.
That's correct.
Wonderful. Great. Thank you so much.
Thank you so much
for having us.
That was
fascinating. Dr. Amy Ty, who is a neurologist at Christiana Care. When we come back, our friends at Willie Farms are here, and they have a demonstration for you when the Delaware Way continues.